Most people over 60 believe that using eye drops is harmless, just a quick solution for dryness or redness. But what if I told you that the very drops designed to protect your vision could actually be making it worse? Millions of seniors use eye drops every single day, but few realize that hidden habits around these tiny bottles may quietly damage their eyesight, sometimes permanently. Today, we're exposing the 6 most common mistakes seniors make with eye drops, habits that doctors warn against, yet most people never think twice about. Some of these may sound familiar, and by the end, you'll know exactly which ones to avoid to protect your vision for years to come. Before we dive in, make sure to subscribe and hit the like button. If you've ever struggled with dry eyes or relied on eye drops daily, share your experience in the comments. We'd love to hear from you. Now let's uncover the first hidden danger. It starts innocently. You notice your eyes look bloodshot, maybe after a long day of reading or spending hours on a computer. You reach for that familiar redness relief bottle, and within minutes, your eyes look clear again. Problem solved, or so it seems. But here's the truth doctors don't always emphasize. Those redness relief drops often contain vasoconstrictors, chemicals that shrink the tiny blood vessels in your eyes. Yes, they give you that quick cosmetic fix, but the more you use them, the more dependent your eyes become. Over time, your blood vessels adapt. Once the effect wears off, they actually dilate even more, making your eyes redder than before. This is called rebound redness, and it's one of the sneakiest traps seniors fall into. The drops stop working as effectively, and you find yourself using them more and more just to maintain the same result. It's like chasing a short term fix that slowly worsens the problem. Even worse, long term use may reduce oxygen flow to the eye tissues, leading to irritation and potential damage. The irony, what you thought was helping actually creates a cycle of dependency. And that brings us to another surprisingly risky habit, one that has less to do with what's inside the bottle and more with how long that bottle has been sitting around. Think about how often you found an old eye drop bottle in your medicine cabinet. Maybe you couldn't remember when you bought it, but since it wasn't empty, you thought, why not use it? Or maybe you've borrowed your spouse's drops just once because you were out of your own. Seems harmless, right? But these small decisions can open the door to infections that are far more serious than the temporary dryness you were treating. Eye drops, like any medication, have an expiration date. After that date, the preservatives that keep bacteria out start to break down. Once that happens, every squeeze of the bottle could be delivering more than just liquid. It could be introducing bacteria straight into your eyes. For seniors whose immune defenses may not be as strong as they once were, this can quickly lead to conjunctivitis or even more severe infections. Sharing bottles makes the problem worse. Even if your partner or friend swears they're healthy, they could be carrying bacteria without knowing it. One drop or tip touching someone's eyelashes is all it takes to transfer germs. And because the symptoms often start mild, just a little irritation, you may keep using the contaminated drops, not realizing you're feeding the infection. It's a mistake so common that eye specialists see it all the time in older patients. And it leads directly to the next habit, one that sounds harmless but can actually cause permanent vision loss if ignored. Prescription eye drops, especially for glaucoma, are essential tools for protecting vision after 60. Yet studies show that a large number of seniors either forget doses, skip them intentionally, or in frustration double up when they remember later. On the surface, missing a dose doesn't seem like a big deal, but with glaucoma, even occasional missed drops can allow pressure to build inside the eye, silently damaging the optic nerve. Once that damage is done, it's irreversible. On the other hand, doubling up on doses can create its own problems. Many glaucoma medications are designed to be absorbed in small, controlled amounts. Using too much doesn't increase effectiveness. It just increases the risk of side effects like dizziness or changes in blood pressure. Even space and mistakes matter. If you use multiple types of eye drops too close together, the second drop may wash the first one away before it's absorbed. That means your treatment doesn't work as intended, leaving your eyes unprotected. Doctors emphasize timing, but in daily life, it's easy to forget. Maybe you take your pills at breakfast but can't remember your drops until bedtime. These tiny mistakes add up. And unlike redness is relief drops, where the danger is cosmetic, prescription mistakes can cost you your sight. But the risks aren't only about timing, they're also hidden in the very ingredients of the drops themselves. Have you ever noticed a stinging or burning sensation when you use certain drops? That's often caused by preservatives, specifically benzalkonium chloride or BAK. This chemical is added to many eye drops to keep them bacteria free. While it does that job well, it can be harsh on aging eyes, especially when used frequently. For seniors with dry eyes, multiple daily applications of preservative heavy drops can actually worsen irritation. Over time, back exposure may damage the corneal surface, slow healing, and even accelerate age related eye conditions. It's a cruel irony. The very drops meant to soothe discomfort can make it worse if you use them too often. The good news is that preservative free options are becoming more widely available. They come in single use vials or special bottles designed to keep bacteria out without harsh chemicals. If you're using drops several times a day, switching to preservative-free versions is one of the simplest and most effective changes you can make, but even the safest drops can be undermined by one overlooked factor: how you actually put them in. It sounds simple: tilt your head back, squeeze the bottle, and let the drop fall in. But many seniors make small mistakes that have big consequences. The most common: letting the bottle tip touch the eye or eyelashes. That one moment of contact can contaminate the entire bottle with bacteria. Every use after that spreads germs directly into the eye. Another mistake is failing to close the eyes properly after applying drops. Many people blink rapidly or move around right away, causing the drop to leak out. Others don't press gently on the inner corner of the eye to block the tear duct. Without that step, much of the medication drains into the nose and throat instead of staying in the eye. Not only does this reduce effectiveness, but it can also allow the medication to enter the bloodstream, triggering side effects like heart rhythm changes or blood pressure fluctuations. These technique errors are rarely talked about, yet they can undo the benefits of even the best prescriptions. And unfortunately, many seniors don't learn the correct method unless a doctor or nurse shows them step by step. But even with perfect technique, there's one habit that puts vision at the greatest risk: the tendency to rely on drops instead of proper medical care. Eye drops may look harmless, but the habits surrounding them can shape the future of your eyesight. Overusing redness, relief drops, holding on to old bottles, skipping or doubling prescription doses, relying on preservative heavy formulas, using poor technique, and self treating instead of seeking medical care. These are the silent mistakes that often go unnoticed. The good news: every one of these habits can be changed. Choosing preservative free options, learning the correct application method, and committing to regular checkups can protect your vision well into your later years. Remember, your eyes have carried you through decades of experiences. They deserve careful attention now more than ever. If you found this video helpful, please subscribe to Senior Health Guide, give it a like, and share your own experience in the comments. Have you ever noticed side effects from using eye drops? Your story could help someone else protect their vision too.